Not sleeping well? This is something you may want to try. What's up, beautiful people? Another day, another study. We've talked about magnesium a lot before on the channels. We've even talked about magnesium for sleep. Poor sleep quality is something reported by nearly 1 in 3 individuals. And this is not meeting the criteria of insomnia. This is different. This is just people who report that they may not sleep well. But we know sleep disruptions are linked to things like cognitive impairment, mood disturbances, poor mental health, worse cardiometabolic health markers. Magnesium has many functions in the body. It's important for cardiovascular health, muscle health, nerve health, metabolic health. Observational studies indicate that higher magnesium intake is associated with improved sleep parameters. While randomized controlled trials on magnesium supplementation have been mixed, we've covered that before, and that may be due to different parameters with how different forms of magnesium are absorbed. Forms like magnesium bisglycinate, we think, cross into the brain based upon animal studies. This 4-week randomized controlled trial compared magnesium glycinate with a placebo in healthy individuals reporting poor sleep. Very important, the excluded people with a lot of chronic illnesses and people who had diagnosed insomnia. So these are not people who have insomnia diagnosis, but they just report not sleeping well. So the intervention, participants consumed either placebo or 250 milligrams of elemental magnesium with approximately 1,500 milligrams of glycine 30 to 60 minutes before bed. They use something called the ISI, which is actually a score that I use with my patients when we're evaluating sleep and interventions to improve sleep. So ISI scores were significantly reduced in the magnesium group by about 4 points, about 28% reduction compared to the placebo group, about 2.3 points, 18% reduction. The effect size overall was small, so we're talking about modest improvements, however, still improvements. And given magnesium has an excellent safety profile and is relatively cheap, this is something that I often recommend for people. Now, usually a 6-point reduction in the ISI score is clinically significant for people who actually have an insomnia diagnosis. 11% of the placebo participants achieved this score reduction compared to 19% in the magnesium group. And in a secondary analysis where they looked at people who strictly adhered to the protocol, there was improvement or more improvement in the ISI scores by about -5 compared to the placebo group, -3.1. However, in secondary analysis using other questionnaires, including things like perceived stress, affect, depression, anxiety, there was not a statistically significant difference. That may have been just because of the length of the study. It was a shorter study, 4 weeks. Sometimes seeing improvement in these other markers requires a longer period of time. The intervention was well tolerated. Only 2 adverse events were reported in the magnesium group, 1 dizziness, 1 joint pain. Now, a problem with the magnesium supplementation in this area is that oftentimes you're not told how much glycine is in the magnesium products. If it's a powder, you can kind of estimate based upon how much elemental magnesium they say is there in the total weight. But me personally, I use magnesium oxide. It's just more bang for your buck, more elemental magnesium. And I take 3 grams of glycine a night for sleep purposes. Have you used magnesium or glycine for sleep? Let us know down below.